and welcome to our podcast, Public Health Research and Me. This podcast is led by public partners from FUSE, the Centre for Translational Research in Public Health, and brings together the 5 North East universities of Durham, Newcastle, Northumbria, Sunderland and Teesside in a unique collaboration to deliver world-class research to improve health and well-being and tackle inequalities. FUSE is also a founding member of the NIHR School for Public Health Research. So my name's Victoria Bartle, and I'm a public partner collaborating with FUSE on creating this podcast. And I've been involved with research from a patient and public perspective since I had to stop working in 2016 due to multiple long-term health conditions. I really love being able to influence health and social care research. And I know that the input from every public partner makes research more focused on benefiting us all. So today I'm going to be talking with Cassey Muir, who's an NIHR School for Public Health Research doctoral student. God, that's a good title. I'm very jealous, that's lush. As well as a FUSE associate member who's based at Newcastle University. So hi, Cassey, thanks for joining us.
Hello.
If you just want to start with telling me a little bit about the projects that you're working on at the moment.
Yeah, of course. So hi, everyone. I'm currently a final year PhD student where I focused on young people who experience parental alcohol and or drug use. And my PhD aimed to answer the question, how can we support young people whose parents use substances? So to answer this, firstly, I conducted a qualitative systematic review of young people's experiences of parental substance use, which is looking thoroughly at all the published work and findings where other researchers have chatted to young people on their views and perspectives. And from this, I identified 35 unique studies covering the views of over 700 young people from across 20 different countries, the youngest being 4 years old and the oldest was 30. So it's like very big, wide range. And the findings from this bit of work then led into my own qualitative field work, where I interviewed 21 young people aged between 14 and 24 from across England and 44 practitioners who provide support to young people who have experienced parental substance use. And this work was really trying to explore young people's experiences of support, their support needs and ideas for future intervention.
Oh, wow. That sounds absolutely amazing.
So much work over the past.
No, that's brilliant though. Like I've been reading your research in preparation for this interview, and I've just been blown away with like how engaged you are with the topic. And I was just wondering, like, what drew you to children and adolescents and young people's mental health and parental substance abuse?
Yeah, so I guess I think I've always just really had an interest in young people's mental health. And when I was younger, I used to always read like Jacqueline Wilson books, which very much kind of depict the lives of different families and childhood experiences. I also really liked reading sort of self-help books, as one of them being, I think it was called Chicken Soup for the Teenage Soul, which had like little stories from across the world of different kind of things that young people felt and how they had experienced things. I then went into psychology at degree level, obviously, piquing my interest more with mental health. And during that time, I was a peer mentor with Children North East, which is a local charity who support families and children. And I worked one-to-one with young people who'd experienced some form of adversity to become more confident, independent, and really just supporting their social well-being.
Oh, that sounds amazing.
I think those experiences really shaped kind of me to want to focus on children and families. And then also when I was a teenager, I also experienced substance use within the family and know kind of how it feels to feel alone in that situation and like you can't ask for help and that there isn't much support out there, or you just don't know about support. So that made me really kind of want to work in this area. And then fast forward, an opportunity arose to do this PhD working with a team I like really admire and got on well with, and it just felt quite serendipitous to just go for it and apply, and here we are now.
Oh, congratulations. That sounds so amazing. Like just the work that you've done like with children and young people, and it sounds like you just get so much out of that. And as a person who's experienced parental substance misuse myself as well, it is quite isolating, and you don't know what's out there and you don't know what's available. And like, I was a lot older when it kind of impacted me. So I just think your work's absolutely phenomenal. So yeah, so obviously I'm engaged with research from the public perspective. So could you tell me a little bit about how you got the public involved with your research projects and kind of what impact that had on it?
Yeah, definitely. So I mean, first of all, I've just really loved collaborating with young people on this project who've got lived experience. And it's really kind of grounded my thoughts and driven my analysis and ways of thinking throughout. And I've also had the opportunity to work with AdFam, with their Chief Executive, Viv Evans, who's been an advisor and supervisor on this project.
Can I just butt in there? What's AdFam?
Just about to tell you, yeah.
All right, sorry.
No, it's fine. So AdFam is the only national charity tackling the effects of alcohol, drug use or gambling on family members and friends. So it's been really great to have them involved and their input and their knowledge really in this area, in this field, and their connections to services.
Mm-hmm. Oh, that's brilliant.
The start of the project, I was really lucky to collaborate with a great Northeast based charity. So they're called Props Family Recovery Service, and they work with families and children who've experienced sort of family substance use or friend substance use. And they had a group of young people, and they sort of used that group as a way of kind of helping advise on my project. So those young people had lived experiences, they already knew each other, they knew the support workers, and they really helped kind of structure the start and kind of come up with the kind of decisions at the start of my PhD.
Wow.
It helped identify how we could approach young people, so kind of going into services, developing some of the materials, so kind of changing the colours and whatever else other information needed to be on the recruitment materials. They also helped come up with the project name, which is SPRING, which is kind of both an acronym and also has a connotation to resilience, that kind of bouncing back and new, newness to it.
Yeah, it's nice and positive. It's lovely. Yeah. Mm-hmm.
Yeah, a good positive word to kind of talk about what the research was. So initially I'd kind of started off and it was looking at obviously support, and it was going to be looking at resilience. And I took some initial findings to them from the other research, so the systematic review that I was doing. And it was really trying to think about what was missing in the research to date. So we looked at kind of other authors' themes and trying to see if there was any gaps or what I should focus on. And what young people had said was that there didn't seem to be much around how that young people can feel different to their peers and how they felt isolated and like they had to keep everything hidden from others. And with a separate conversation with the public partner from AdFam, she also mentioned that there seemed to be stigma missing from the current literature in this field. And obviously that was exactly what the young people were describing, the sort of experience of stigma. So that really guided the project at the start and helped to explore both resilience and stigma and how that links with support.
Wow. Sorry, every response I give is just wow. I'm just really enthused about your research. It's really exciting and innovative. And I know some researchers don't like the systematic review sections of the research project, but just from what you've been saying, it was really important to do that and then speak to people with lived experience to see where the gaps were, and then they've helped you identify them, and now you're doing research that's actually relevant to the people who are living it and going through this every day. So that's kind of what we hope for PPI.
Yeah, exactly. And especially that it kind of the young people with lived experience and, the practice side with AdFam, both having very similar views that something was missing. So it definitely felt like the way forward. But obviously, as of everything with COVID and the pandemic, that advisory group unfortunately had to kind of end due to obviously restrictions and everything going on. But I started up my own group after kind of doing some of the interviews with young people. I ended up getting a group of young people from across England, and we met online to discuss other findings, so the interview findings and so on, and to start prioritising some of the intervention ideas. They also helped spread the word of the study and got their friends involved in the interviews, which was really great to see that the project meant a lot to the young people taking part, and that they were, wanting other people to take part in it as well. So I think that was, really, really useful.
Yeah, no, that's amazing. You can see that they obviously were engaged with it and impacted by it, and especially if they wanted to carry on doing it through COVID and lockdown and everything. Like, there was so much stress and just it was just an awful period for everybody, and then for these kids to want to be involved is just phenomenal, to show like the impact of what you're doing, that it does actually touch people's lives, like really importantly.
Yeah. The young person advisory group also kind of changed my perspective on resilience. So I think that was mainly that they just didn't really like the term, and they said it was kind of overused, and to them it usually meant, and in their kind of experience, that it was young people doing well at school, and that's kind of how they sort of perceived what it is to be resilient. But to them, they thought of resilience in terms of kind of surviving versus thriving, and professionals need to determine whether a behaviour was then the young person surviving or thriving. And I guess as a kind of example of that, so a young person may be seen as resilient at school when they're doing well, getting their homework done, getting good grades. Yet the young people had said that that may also be a survival technique which needs to be looked at. So is the young person trying to seem like they're doing well so that they don't get singled out? Are they putting all their effort into schoolwork because they don't want to focus on home life? So they're doing their homework just so they've got some time to focus on something else. What may seem like resilience to the outside world may actually be the young person trying to survive, which can then limit their opportunities for support and continue it to be a hidden. Just thinking about it like that and from their perspective really helped me kind of think about resilience as well in terms of this, and how that also links to stigma and trying to make it seem like there might not be any issues at home, or there might not be any problems. So yeah, it's definitely been absolutely fabulous having them involved, and they helped present the findings of the project to over 100 practitioners online. They shared
Really? Oh, fantastic.
We had a big sort of Fuse AdFam in the School of Public Health Research online event where it was well attended, and then they shared their experiences. They helped me kind of develop some of the workshop activities, and one young person from that group has reflected that the group, just being a part of that group, she's realized that she wasn't alone in her experiences. There were other people that had similar experiences and she'd never had that opportunity, so that it gave her that opportunity to meet new people.
Yeah. Oh, that's so fantastic. What you've just been talking about kind of makes me think about like masking behaviors of people with autism and different like neurodiversity, trying to behave in a certain way to fit in with society because that's what's expected of you, and then you go home and kind of it all spills out, or if you're in a situation where you're dealing with substance misuse at home, then you don't have the opportunity for it to all spill out at all. And so stigma is going to be a huge factor in how we address this as society, and like how we approach it to help children and young people. So what kind of conclusions did you come to then? How are we meant to improve things?
Lots of different ways, and I think there's definitely lots that needs to be done. And the majority of kind of interventions and support currently focus on the parents and trying to reduce the risk to the child. So trying to, improve or reduce sort of drug use or alcohol use. And, there is definite need for that, but we also need to think about how can we support the young people as well, because my research was finding that young people in times when their parents maybe weren't using or they were in treatment, that can actually be really anxiety provoking for young people, and they start to worry about, is it going to happen again? So that they still, they still need to have the support in place. As well as that, there are very limited number of evidence-based interventions for young people currently, which are very kind of low effectiveness. So they don't really have that great of improvements for young people. And that's not to say that there's some really great support services across the UK, because there definitely are. And they're doing really great work with very little funding. And I guess that is one issue that, does need improving. There's currently no requirement for local authorities to offer support to young people who experience parental substance use, and therefore service provision is patchy across England. Depending on which local authority you live in, it depends if there's support for a young person. And I think that's just not enough. That's not good enough.
No, that's really surprising to me. I didn't realise that there was no not need, but there was no service provision that you had to to provide. Like, that just seems, it doesn't seem right to me.
No. So some areas really great commissioners who commission services have got like lots of access, whereas there's other areas that don't have that. And a lot of the services are generally quite siloed, so they're kind of working on their own and not really linking up with other services in the country, especially to kind of learn from that and to find out, what works, what doesn't, how can we engage commissioners and things like that. So I think more needs to be done with kind of, the networking and sharing of resources across services too. I think one of the kind of key areas as well with my research and that I've tried to focus on is that young people are not kind of passive in their experiences, that trying to recognize that young people are showing agency and tenacity to find ways to support themselves, to protect their siblings, to try to control the uncontrollable. And this is really usually without any formal support in place. They're doing this for themselves. And it's to kind of not take away from that and to really make sure that support that they can access allows them to, exercise their agency and choice. So for instance, young people as kind of intervention ideas or resources had said that it would be good to develop digital applications or websites that young people can access, especially teenagers and young adults. They can access them at any time of the day. They can choose what topics or sessions they want to go through, to hear about other people's stories that are similar to them, and that this could act as a gateway to in-person support. So to help reduce the stigma of speaking out and accessing support, to kind of, dip their toe in as such, or it could be used alongside, in-person practitioner support as just a way to help engage. There are obviously issues with digital poverty and, things like that, but I think it's more of a suite of interventions, and more needs to be done in terms of supporting young people.
I guess if there's no necessary provision from local councils, that a lot of it will be delivered by charities and third sector providers. So kind of ideal world scenario, what do you see the role of, say, you were talking about digital poverty and other forms of exclusion, and I'm assuming that the criminal justice system would come in at some point, and education is going to be massively important for teachers to help identify children who are at risk, but also just society in general to make sure that we're able to identify these issues and put something into place to support these children and young people. So I'll give you a magic wand. Here you go. What would you like to see in terms of structures and systemic systems to help tackle these issues?
Yeah, I mean, we definitely have to create sort of resilient systems around young people, and a lot of my work focuses on what can we do for young people, but within that, they've also talked about things with regards to system change and poverty and having fairer access to resources. And I think in general, with regards to sort of what the young people had said as something that would be useful to them, is training for other professionals or adults and who may encounter young people or children. So within the health and social care sector, within the justice system, within the educational system, around, parental substance use, the impacts to young people, how young people cope, what that may look like, that sort of, the thriving versus surviving examples with regards to the educational system, and to really try and take a trauma-informed approach when supporting young people, to think about non-stigmatizing language, respectful relationships, trying to create safe spaces for young people to open up, and allowing them to kind of help make decisions about their own support. So I think that was really one way that it was a prioritized intervention from both practitioners and young people that isn't directly for young people, but is something that they want, that would actually be really helpful, and to kind of, start and have that sort of systemic change for the best. And I guess within sort of educational establishments, a lot of the highest priority for young people and practitioners was to develop more educational resources for children and young people. So this was very much to kind of co-produce them with young people. They wanted it as early as primary school, like early prevention, have these conversations early, try to reduce that stigma from a young age. If it's talked about in primary school, talked about through secondary school, it becomes more of a norm and a dialogue within the schools, for both those experiencing it and those who aren't. And I'm currently working with a national charity to develop resources to be used within schools, and that's really a focus on the emotional impact of living with parental substance use and how that may show up or not show up in school. So that's going to be an add-on to kind of normal kind of curriculum, and teachers can use it and play the video, and I think it'll be useful in terms of other areas. It doesn't just have to be parental substance use, because we're focusing on the emotional impact and emotional and social well-being. So I think that's a really good way of getting into schools and trying to change that system.
That sounds absolutely phenomenal. Like the impact that could have, to just reduce the stigma and to normalize it, like you said, to normalize different situations. So not just parental substance misuse, but anything that's kind of seen as out of the norm that then becomes stigmatized because you don't talk about it. So if we open the lines of communication, then it could just have a huge impact on people's well-being and just general mental health. Yeah.
A young person had said that, if someone just had those conversations earlier on at primary school, secondary school, that they would have felt less alone. They may not have accessed support, they may not have, gone down formal support route, but then they would have felt less kind of that internal stigma or internal shame, and they would have felt like actually somebody cared, somebody was talking about it, somebody wanted to help. And I think that's really important for these kind of conversations, that it might not increase referrals to services, but actually it might decrease the sort of internal stigma and shame that the young people might face.
Yeah, it just, like you say, normalizing it means that you can talk to your friends about it and you won't experience that stigma. But knowing that it is a thing, that it exists in the world, that it's not just you and your family or your environment or whatever, that it's bigger than that, and there's other people who are experiencing it. I mean, you talk about all the different intersecting factors contributing to stigma and discrimination. And from a disabled person's point of view, I find that so interesting, because you can just see how socioeconomics and gender and age and loads of other things intersect to form like inequalities. So what do you see as the biggest impact with regards to your research on like social inequalities?
Definitely there are like many intersecting factors for young people who experience parental substance use, and it very much links to another project that I'm working on, which is called Oracle, which is overcoming adverse childhood experiences. And that's sort of focusing on parental substance use, parental mental health, domestic violence and abuse, and poverty, and how those kind of overlap. And there are lots of kind of overlapping and compounding issues, which can all lead to stigma and discrimination. And colleagues on that project found that poverty can amplify children's experiences of these adversities, which can lead to kind of worsening of outcomes, especially with poor mental health. And that, more needs to be done with regards to policies around poverty and improving financial situations, and especially with the kind of, the energy crisis and the cost of living crisis at the moment, is these things are really going to impact the most vulnerable first. So definitely more needs to be done. But in young people had described times when they not only kind of stigmatized or bullied for having sort of parents who use substances and the stigma that surrounds substance use, but also because of the financial situation of their family. If they can't, if they're not wearing the best clothing or they're not having the right equipment for school, definitely more needs to be done. And Children North East, as an example, they're doing something they've called poverty proofing. And an example of this within the sort of school system is by kind of going in and making sort of the school aware of how they might be unintentionally promoting stigma or limiting young people's access or opportunity to participation. So kind of including how they deliver free school meals, how they plan non-school uniform days, especially if it's kind of with a donation, making that a bit more like in a bucket instead of kind of going around every person in the class, or having a non-matching sock day. So instead of kind of, a non-school uniform, and trying to think about how that kind of can impact on PE kits as well and activities outside of school, and really trying to, promote an environment where there isn't stigma because of the poverty, and that can support lots more families than just sort of looking at it from the parental substance use. There's obviously a lot of other families who would benefit from that, and children who'd benefit. So I definitely think that's kind of, from the research that I know so far, is the kind of biggest impact.
Right. Well, I've just realised that I've been stigmatizing it all the way through in my language, and you should have challenged me, because I've been saying substance misuse all the way through, and it's substance use, isn't it? Sorry. So I apologize, and I'm learning. So parental substance use.
Yeah, there's always, it happens.
Mm-hmm.
But it's been aware, isn't it, and acknowledging.
Yeah,
that. I think that's another way of kind of moving forward as well.
Mm-hmm. Fun. So I apologize for that, and thank you for teaching me something today. So look into the future, kind of where do you see the areas for further research in this kind of area of study, and have the children and young people that you've been involved with pointed out stuff that you want to look at in the future?
Yeah, so I think, one of the main ones that I haven't really explored is that I think more needs to be done regarding younger children, especially as sort of primary school age was, prioritized as a one of those main areas that we should be intervening at. So I think more needs to be done with kind of including younger children, getting their opinions on how we can do this, kind of, go into primary schools and teachers and staff and thinking about how we could, utilize some of these methods and education resources within primary schools. And I think, thinking about the emotional impact could be one way of doing that, because there could be lots of different children experiencing different types of emotions for different reasons. I also think that further research is needed exploring that system-wide change. So, thinking about tackling policies and the cost of living and how that can impact outcomes for children and young people. And then also just needing to further develop and co-produce resources for young people within the educational system, or like digital apps or websites, and think about, how best is that accessible for the young person, and then sort of pilot it and feasibility test it across sites. So I think they're the kind of main things, but definitely kind of thinking about how could we target and get into primary schools and start that conversation with younger children.
It sounds like you're going to be busy for the rest of your career with all of this, fixing all of these problems for us. So if you had one message for our listeners to take away, what would it be?
I think, put simply, it would be to be kind. And you don't always know what somebody is going through or has been through. And there is so much sort of hidden trauma and hidden things that people don't talk about. That we should all just be being kind and compassionate to people, and not using kind of stigmatizing or derogatory language or views. And I guess if we could help just one person to not feel alone today by just engaging in this conversation, then I think that's worth celebrating, because, you're not alone. There are people who've experienced very similar things, and there are people who want to help, and hopefully we can, develop even more services and interventions that can be useful for young people as well.
Well, that's just such an amazing message to end on. That was lovely. Thank you so much for your time, Cassey, and good luck with all of your research in the future. I've thoroughly enjoyed learning about it, and from my perspective, just to see that people will be helped and that they are being helped is just amazing and really touches my heart. So well done, and thank you so much.
Well, thank you for having me and letting me ramble at you for the past 20 or so minutes.
Not rambling at all. It's been amazing. It's been really, really interesting. Thank you.
Thank you, Victoria.
So if you're a fan of our Public Health Research and Me podcast, please subscribe on your preferred streaming platform. Let us know how we're doing with the rating or review, and share with your friends, family, colleagues and networks. Thank you, and we'll see you next time.